Hi everyone, thank you for viewing my presentation. My name is Lauren Trembley and I'm a Medical Education Fellow in the Department of Emergency Medicine. My project is the use of ultrasound in introducing anatomical pathology to preclinical medical students in correlation with physical exam curricula. This is a project which I actually started working on during my residency training here at Pitt, and I'm glad to present it to you today. Point-of-care ultrasound has become an important diagnostic tool in many clinical settings used by many different specialties. Recognizing the greater role that ultrasound is playing in clinical practice, medical schools have started to incorporate instruction on ultrasound into their curriculum. Sometimes this has taken the form of an elective rotation for the students in their clinical years, and then other schools have implemented ultrasound instruction earlier, introducing it into the physical exam curriculum in the preclinical years. Here at Pitt, there is already an established mini elective rotation for the first and second year medical students that introduces these learners to ultrasound in correlation to their physical exam curriculum. Despite these responses, however, there still exists a knowledge gap in distinguishing between normal and abnormal findings. What typically happens in ultrasound training is that students typically practice their ultrasound skills by either scanning themselves or by scanning standardized patients. In doing so, they are likely exposed to a myriad of normal findings and variations of normal findings and become really adept at identifying them. However, without being exposed to any abnormal findings or pathologic findings, it can become confusing in distinguishing between normal and pathological findings for the learners. Therefore, this curriculum attempts to fill this knowledge gap by using ultrasound as a modality to introduce anatomical pathology to preclinical students. The three main course objectives for this course are that preclinical medical students will be able to distinguish between normal and pathologic anatomical ultrasound findings through clinically based case examples, to identify several predetermined anatomic pathologies of the anatomical regions covered, and to demonstrate how to obtain adequate sonographic images of the selective anatomical regions through scanning practice with partners. We chose to implement this ultrasound pathology course as an adjunct to the course or the mini elective rotation already here at Pitt called Ultrasound Basics, Correlation with the Physical Exam. The course is 4 90-minute weekly sessions. For each session, the students first meet in a large group setting where they listen to a brief didactic on introducing them to basics of ultrasound and the introduction to the anatomical region covered in that session. They then break off into small groups of 3 to 4 students and practice scanning the correlating anatomical region on ultrasound with a facilitator. The new pathology sessions were implemented after the scanning portions of each weekly sessions of the original course. So after their scanning practice, they would return to the large group setting and listen to another 20 to 30 minute didactic, this time focusing on the corresponding pathologies or sonographic pathologies to the regions that they just practiced scanning. Each presentation was designed in a case-based format, presenting high-yield clinical presentations of various pathologies in which point-of-care ultrasound can be a useful diagnostic tool. The 4 sessions covered were the FAST exam and examination of the trauma patient, cardiac and lung, abdomen, and ocular and access. Just as an example, I have 2 images from the first session here on my poster. On the left, you can see a normal right upper quadrant view of the FAST exam, pointing out the appropriate corresponding anatomy. On the right, you can see an abnormal right upper quadrant view with blood in Morrison's pouch, which is indicative of intraperitoneal bleeding and would be an abnormal finding. The normal FAST exam views are presented first in the lecture, and then a few cases are presented at the end. The abnormal right upper quadrant image is part of the case in which a young male presents with abdominal pain after a motor vehicle accident. Students are able to make the direct and timely comparison between the normal and pathologic findings on each view of the FAST exam in the context of this patient's case presentation. At the end of the course, students were emailed a 7-question survey for evaluation. Survey results were generally positive. In particular, 71% of respondents answered strongly agree to the item which addressed the first learning objective. This item was learning pathologic correlates to the physical exam helped me better understand normal anatomy and physiology. Open response feedback was also positive and highlighted that the pathology portions complemented the existing course well and suggested that they be continued. I do feel that the major limitation of this course is probably mostly the subjective evaluation, and going forward, I would like to implement more robust objective evaluations. Specifically, we could implement some form of formal or summative evaluation quiz at the end of the course in which students would have to correctly identify normal versus pathologic ultrasound clips or images. However, I feel that there are still many strengths to this novel course. First, it enables learners to acquire a basic ultrasound skill set at an early stage in their training, preparing them for more advanced practice during their clinical rotations. Next, by using a case-based format, it provides students the clinical context of high-yield diagnoses that can be made by point-of-care ultrasound. Finally, it exposes learners to anatomic pathology at a time in their training when they are overly exposed to normal findings. This enables them to better distinguish between normal and pathologic anatomical findings. Though we chose to implement this pathology course as an adjunct to the mini-elective physical exam course here at Pitt, I designed the pathology sessions to be able to stand alone, and therefore they could easily be adapted at other institutions as well. So that's all I have for you. I thank you for your attention and enjoy the rest of your day.